Hello, and welcome to the 48th Annual AAKP National Patient Meeting. Transforming American Kidney Health, Patients Take the Lead. I'm Sharron Rouse, and I'm the proud founder of Kindness for Kidneys International Incorporated, a voluntary nonprofit health organization dedicated to raising awareness and public education of kidney diseases. I'm also an AAKP ambassador for the state of Maryland and a grateful kidney transplant recipient thanks to my sister. Being an AAKP ambassador has provided an opportunity for me to connect with so many powerful kidney warriors around the world and to use my voice and my experiences in a meaningful way to demand more innovation and more choices for myself and others diagnosed with kidney diseases, as well as those yet to be diagnosed. As a member of AAKP, I share the message that every patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovation so that we are continually advancing care, improving treatments, and providing solutions for unmet patient needs. And when those innovations are FDA approved, it is crucial that all patients have access to the right choice of treatment for them in consultation with the doctor they choose to care for them, so every patient can live their best life and achieve their aspirations. And with that, I'm pleased to introduce our next session titled Key Learnings and Observations: Need for More Research on Fatigue in Kidney Disease. Earlier this year, AAKP was honored to play a significant role in a workshop organized by the National Institute of Diabetes and Digestive and Kidney Diseases on the topic of post-dialysis fatigue. Despite its substantial impact on patients, post-dialysis fatigue is often overlooked and greatly misunderstood by clinicians. This meeting is aimed to bring together individuals with kidney disease, clinicians, researchers, and members of the kidney community to collectively address this issue and identify scientific gaps and opportunities for advancing our understanding of this under-recognized but significant complication of dialysis treatment. AAKP collaborated closely with our longtime friend, Dr. Kevin Chan, a senior scientific officer at the NIDDK, who spearheaded this event alongside AAKP Ambassador Don Edwards. Dr. Chan's expertise lies in managing kidney clinical trials, molecular epidemiology, and clinical informatics. He is also responsible for overseeing the design, analysis, and interpretation of both randomized clinical trials and observational epidemiology studies. Today, we are fortunate to have Dr. Chan join us to share the insightful findings from the post-dialysis fatigue workshop. Dr. Chan, I turn the program over to you.
Thank you, Sharron. Thank you, AAKP. I'm happy to be here today to talk to you about patient science to you, the patient, in the setting of post-dialysis fatigue. So I wanted to start about talking about the state of chronic dialysis in America. What we do is we use outcome measures to benchmark the state of dialysis. So according to the United States renal data systems, what we've seen is that there's about the rate of new dialysis patients is 363 per million people. It's been decreasing over the past couple of years. The death rate is 186 deaths per thousand patients, also decreasing over the past few years. Hospitalizations are also improving. Right now, the average hospitalization is about 1.5 hospitalization per patient, and the cost of care to Medicare has also been decreasing, $50.8 billion in 2020. In this slide, what I want to do is I want to reframe the state of chronic dialysis using this iceberg model. And what it is as an iceberg, it has a tip above the ocean, and you can see it. What you can see is these measured outcomes, and this is how we benchmark the state of dialysis right now, because we can measure and report survival, hospitalizations, and costs, for example. And as patients, you know what your laboratory values are, and you get report cards, and you may have perfect numbers. But the state of dialysis may not seem acceptable to you as patients because there are hidden and unmeasured outcomes, things that we don't measure. And these are things that about how you feel, about your aspirations, your vitality, pain, insomnia, fatigue, and whether you can eat, sleep, walk, and how well you can do that. These are the types of outcomes that patients report, and that only you as patients, and I've just put some examples here myself, but you as patients need to define and tell us so that we can get a better understanding and better outcomes for how we can benchmark the state of ESRD in this country. So this is Dawn Edwards. Many of you know her. She's a patient and a patient advocate. She suffers from something called post-dialysis fatigue. For many of you know Dawn, she's upbeat, she's social, and she has a strong patient voice. But she's also on dialysis. The side effects of dialysis is one of them is post-dialysis fatigue. So what I want to illustrate with this picture is Dawn and how she described that she walked into dialysis as an A-plus employee in her dream job as a post office. After the treatment, she was debilitated by post-dialysis fatigue, and this portrait illustrates what happens after dialysis when she goes home. She's depleted, she's washed out, she's incapacitated, in her words, and she described herself as being a different person, almost infantile and unrecognizable. This fatigue rolled over into her life and destroyed many parts of her life. For instance, she lost her job, she lost her husband, and she got cut off from her social connections. She lost her identity. So post-dialysis fatigue, it's the definition is fatigue and the need for rest or sleep, particularly after a dialysis treatment. And it's distinct from just being tired, or that many dialysis patients feel in general. Patients use different terms to describe this, such as exhausted and worn out. And it is common, about half to 85% of hemodialysis get this complication of treatment of post-dialysis fatigue. And there's a clear association between this treatment starting and the associated fatigue that starts to intensify and last for many hours after treatment. We have no diagnostic criteria, labs, or radiological tests to pick this up. We don't know the exact cause. The best way to know about this is from really hearing it from patients and describing it. So Dawn's story called us to do here at NIDDK and NIH, and we hosted a 2-day workshop. And what we did for this workshop is we brought all the stakeholders in the dialysis community together to talk about this overlooked and complicated problem of dialysis treatment. We had 175 participants and 20% of the patients, and we designed this workshop with patients, Dawn, and the AAKP. What we realize is that patients with chronic illness and clinicians experience the same clinical encounter differently. So while patients may focus on survival and lab values, people who are sick may have different aspirations, and we speak different languages. It was important that we wanted patients to be able to participate in this workshop and to be able to feel comfortable to speak. We really need to understand what post-dialysis fatigue was and how it felt like to be able to do good science. So we wanted to make a safe space for patients to be able to participate, and we incorporated many patients into the program to take the lead and to make it a safe place for their colleagues and patients in the audience to be able to talk about their experiences. The goal of the workshop, we wanted to get a better description from patients of what it felt, the fatigue, post-dialysis fatigue felt like, what were the immediate knowledge gaps to impede progress in the field, and how can science really fill these gaps so that we can move forward in this area, hopefully towards treatments and therapeutics. So patients came prepared to this workshop. They had done a survey, and this is what the patients told us at the workshop, that fatigue really doesn't describe what patients feel. They used other words, and this word salad diagram illustrates some of the words they use, such as foggy, vulnerable, zapped out, washed out. It was a much more debilitating than just being tired. We had a patient with myalgic encephalitis and chronic fatigue syndrome come up and tell us is that there are studies in ME's CFS that showed the label of fatigue was had a stigmatizing effect, and it encouraged of this condition by healthcare workers. In fact, the National Academy of Medicine has recommended a new ICD-10 code, which does not refer to the word fatigue in the diagnosis. So our respondents, the patient respondents, told us that the fatigue would last for a good day. So it's not just the treatment; it's what happens after the treatment that they have to put time in for their treatment. And this graph here illustrates how the post-dialysis fatigue affects patients. And what we saw here is a lot of them took about 50% said that the fatigue prevented them from doing full-time or part-time employment. It prevented them from doing many physical things they could do before dialysis as compared to after dialysis, such as cleaning houses, standing, and walking. It affected them, their cognitive abilities from the standpoint of reading, paying bills. It affected their sexual lives, and it affected their ability to experience joy, to be able to play with their grandkids or be able to socialize. During the workshop, we discussed all this, and we discussed about how science can help address some of the key questions that patients had about this condition. And I just want to take the last part of this talk to talk about these findings or these that came out of the workshop. So one of the questions patients had was, should post-dialysis fatigue be renamed so that the name was more reflective of how a patient feels? And what the workshop felt was that to use something called qualitative research, which involves scientists and patients getting together, interviewing, or through group discussions to develop a universal description or a case definition for post-dialysis fatigue. The other questions patient is, how can I get a diagnosis? And how science can work with patients together to do this is by developing a questionnaire, taking the aspects of the case definition and making a questionnaire that can be used in the healthcare field to diagnose post-dialysis fatigue in a universal way and to quantify its severity and impact on life activities. What things would make my post-dialysis fatigue better or worse? So part of the science study would be to gather information on patients, things that in their medical history, things about in their life, things about their laboratory or dialysis treatment. And what science does is we compare these factors in patients with and without and try to identify what is different between the two groups. What happens or what laboratory results are different, dialysis treatment results are different in patients who get post-dialysis fatigue versus those who don't. Why does my body feel this way? So that was another question that came up among patients. And this is where we would also gather the blood from patients. And once again, just like above, we want to compare the blood in patients with and without post-dialysis fatigue. We're trying to understand what are the biological differences and the biological causes behind or underlying and driving this post-dialysis fatigue syndrome. So my final takeaway points is that patients have a role in science in that they can identify how dialysis impairs what they can do, how they feel, and their aspirations, and which ones are the most important. And science can help patients by taking these, what's important to patients, and turning it into what we call a patient-reported outcome. We want to be able to measure something that patients feel or talk about, and that allows us to be able to quantify that and be able to report that on a large scale from the standpoint of which will promote measurement, benchmarking, and future studies. There are no agreed upon criteria for the diagnosis of post-dialysis fatigue syndrome, as we talked about, and not having that is impeding its recognition for us to do new research and to eventually move to drug discovery and best practices to help mitigate this debilitating conditions. And we really need, in such a case, that success will be achieved if patient and science work together to generate the science that is needed in these areas so that we can move forward towards drug development and therapies. So this is a website to the workshop itself, and we have an executive summary for those of you that want to read more about what happened during the meeting and some of the discussions and conclusions. I'd also like to thank members of the patients and members of the AAKP for helping with the workshop, making a great experience for everyone. Most specifically, Dawn Edwards, who played a leadership role in organizing and bringing this to our attention at NIDDK. Thank you very much.
Thank you, Dr. Chan, for sharing the findings from the NIDDK post-dialysis fatigue workshop. I'm thankful that the workshop can pave the way for future research on practices to alleviate this condition. Our next speaker also played a significant role in the NIDDK post-dialysis fatigue workshop. AAKP Ambassador Leigh-Ann Williams was a co-moderator for one of the breakout sessions at the event. Leigh-Ann is a home hemodialysis patient from Louisiana. She works as a program coordinator for the federal 340B drug pricing program at West Jefferson Medical Center and is a postmaster's research fellow at Dillard University. Leigh-Ann, along with other AAKP ambassadors, provided valuable insights from the patient's perspective. We are delighted to have her here today to share her experiences from the meeting. Leigh-Ann, the floor is yours.
Thank you, Sharron, and thank you, AAKP, for having me. I am Leigh-Ann Williams, an AAKP ambassador from New Orleans, Louisiana, and I have been on dialysis for the last 7 years. I am here as a patient that has dealt with post-dialysis fatigue on my own journey. I have been on home dialysis for the last 6 years and have seen my symptoms reduced. But as I participated in the planning meetings for the NIH and NIDDK workshop and talking with my fellow patients about what this fatigue looked like and felt like, and the memories came flooding back. The days of in-center dialysis treatments 3 times a week, walking in, feeling fine, but leaving out every Monday, Wednesday, and Friday too tired, too drained, too sick to do anything but go straight to bed and hope to feel better the next day. The feeling became so routine that it becomes your new normal. We expect it. During the 2 days of workshops, patients bore their souls to share the impact this fatigue had on their lives. Many sharing how it changed their personal lives and their professional lives. Some people having to quit working because they felt too tired or too sick too often after their dialysis treatments. Some people made adaptations to prepare for the feeling. Derek shared of having a sick cup just in case during his drive he began to feel ill. And one of the most humbling moments of the workshop was when my fellow advocate, Dawn, shared an image of the iconic Blue Monday painting. It depicts a woman slumped on the side of her bed, appearing too tired, too weak, to go on. As many patients, many of us have known that exact feeling. It was an honor, however, to be a part of the NIH NIDDK PDF workshop. This was the first workshop of its kind, and Dr. Chan and his staff worked hard to make patients feel included and to make sure that our voices were heard. There were sessions just for patients to express themselves, and the most profound thing to me that came from this workshop was the fact that this problem, unlike so many other issues, crosses all barriers. There are no social factors or person factors that led to people not being impacted. White people, Black people, poor people, rich people, all affected similarly by one thing, that dialysis machine, creating a fatigue in us, a change in us, a feeling in us that we didn't feel before we started that treatment, before we entered that dialysis center. It is so important for patients to speak up and get involved when we can, or when we are presented the opportunity. I am happy that we are transitioning to a time where government organizations like the NIH and NIDDK, researchers and businesses are listening to us in an effort to figure out next steps to improve our quality of life. As patients, we must continue to make our voices heard and share our lived experiences, because we may not be medical experts, but we are patient experts. We are experts of what it feels like to experience post-dialysis fatigue, and after completing a medical treatment that is required to keep us alive. We must continue to push the needle and demand research, demand innovation, demand change, and demand progress, because it's up to us to make change for things like post-dialysis fatigue. Thank you, AAKP, for having me here.
Thank you, Leigh-Ann, for sharing your perspective on being involved in the NIDDK post-dialysis fatigue workshop and how post-dialysis fatigue has impacted you personally. We appreciate all you do on behalf of your fellow kidney patients. If you would like to learn more information about the meeting outcomes, we've made the link available to the workshop's executive summary report within the supplemental resources section of this section block.